viewers khan ge sobke global window de swagat kori ase. The first week of October de India de cough syrup ra bishi bacha khan cough syrup khaile around 22 bacha khan murishi Rajasthan aro Madhya Pradesh de. Inaga homoy de World Health Organization khan ra concern dikhaine report manga piche de. India ra tinta cough syrup to diethylene glycol laga toxic level do contaminated ase koine declare korise. Iniga nishna India Health Ministry ra 6 state irudu Madhya Pradesh, Tamil Nadu, Himachal Pradesh, Uttarakhand, Gujarat aru Maharashtra de kiman manufacture kuri ne se dawai khan idu bi bon kuri dine ase aru tinta dawai ase idu coal reef te 48.6% thagise DEG idu manufacture kurise Shrishant Pharmaceutical aru Recipe Fresh to 1.32% thagise tadibi it do manufacture kurise Rednex Pharmaceutical Private Limited. Aro iniga nishna relief te 1.3% thagise DEG diethylene glycol do. It do Shape Pharma Private Limited khan thagise. Itu laga pore ami kan details pra jankari lobo ne Dr. APONG Longchar MBBS DCH MD Pediatric Allergy and Asthma Specialist ase tagi bilo khuda du kuri sabo. Thank you so much doctor apni apni laga kimti time global window ge kotha kobole homoy de karne.
Thank you so much Global Window for coming for this interview. Apni ani do issue do raise kora do it's very important because ite do October 2nd week ti ai jese but this news has happened and then ite do sob public kan jana go do jani na thakibo. Holibi apni kan idu issue raise kora do bishi important ase because kunuba Chinese kan olop confusion dibi thaki jay. So as a pediatrician monla every day we are facing questions from the parents regarding first to idu hunalo lo cough syrup or cold la kotha honi gena tadi khai gena murise. Iniga news aha sat panic korna parents can be bishi bhoi lagi jaise and unfortunately idia the thick flu la season ase sorti kase even bacha damor kan sob idia bimar hola time ase to iniga time ekta de iniga news hodo it was very scary and then there was so many confusion going on. So thank you so much for giving time and making time for this clarification interview.
Okay, you're welcome sir. Okay, to start with can you just briefly ek bar explain kori dibo paribo exactly ki hoise kiniga khaine to bacha khan iniga murise.
तो इतिया मोहन अपनी बार हाईलाइट करा निश्ना इधर कफ सिरप ला नाम दो कोल्ड रीफ आसे और अलग अलग कफ सिरप पिशी था किसे होली भी एक बार दे है एक ता जगह दे एक ता अनफॉर्चुनेट इंसिडेंट हुआ दो एक ता मध्य प्रदेश से इधर चिनवाड़ा जगह गुना ताते बच्चा का 23 निश्ना मुरीजे को जे so itu de ki hoise gole do cough syrup la bitori diethylene glycol DEG kundu barbar koi thake itu bra he khai gena bacha kan do itu bra effect korna murise. Now diethyl glycol is cough syrup ti do alag alag dawai kan bishi thake component bishi thake gena banai only diethyl glycol do it is not a normal cough syrup ti banala thaliala saman no hoy itu do normally the one plastic can paint can banai no li antifreeze chemical kan industry alag alag ti jay it is not fit for human consumption. So the confusion was that ki itu la cough syrup bithorde itu chemical do ai jayega na itu overdosing la kotha bi noy but wrong prescription la kotha noy but itu first place thakibo na lage but what happened like according to the news and what we infer is that ki hosa la cough syrup ti do glycerol cholai so which is an approved and then it is used for all this thing. It's a food grade chemical as a cough syrup kan glycerol cholai but diethyl glycol do ki kore itu do chola bole la no libi puisa bacha bole or whatever reason itu garne manuan itu unintentionally no na intentionally tagan itu puisa la bacha cost cutting garne cholai na ki inia kotha bolai ase. So it is first place diethyl glycol is not a normal component in a cough syrup. So that is why itu poisoning hoise aru itu kan chemical do bishi over tela concentration almost 40 plus thi thagi je idu kha sat sat bacha kan kunuwa ando idu khai gena idu gan ba jana direct kidney de effect kore to kidney fail hoy gena and then this happens very rapidly ki kha sat sat tela already bacha kan to bimar ase to kha sat sat idu gana kidney effect kuna idu bra bacha bishi mori je. So that is why this that confusion was there.
Okay to aru ekta question hudibole mundu government of India khan ba kile ban kurise cold and cough laga medicine that is also below 2 years of age.
So yes, that is now again the question, the confusion was there. Ki itu bacha itula time di bacha kan itu khai gena cough syrup to that specific cough syrup with the contaminant of the DEG thagena khai gena mura time di government ba sat sat itu time di bi aro ekta ban olai dise. Now cough and cold syrup should not be prescribed for children below 2 years of age ina na
Okay.
but this is not the first time. Even few years back also they had issued warning regarding cough syrup which should not be used for children below 4 years of age. Okay, so now ekta side ti do diethyl glycol la contaminated cough syrup kaina bachagan murise side ti do be issue krise. Now duita dibi cough syrup bi ase but the reason is totally different. Now normal cough syrup to be the bachagan ke mon cholai thake but for less than 2 years of age which we the normal cough syrup te alag alag thake konuba cough suppressing chemical thake dexamethasone nishina no libi konuba cough syrup can be the cough syrup to nam same will be they contain different types of medicines and then we use it according to the condition of the bachagan la kinika bimar se do sagine cholai.
Okay,
Olibi the cough syrup can usually choto bachagan di do tagan cough syrup can cholai siguli bi iman kam bi nakore so it does not help too much. And then most of the time cough kan do bachagan la do sorti kasi do viral infection ni thake to without even bishi dawai na cholai libi naturally bi cure ho jabo lage tai nijor bhal ho jay. Aro bacha chutu kan 2 years and below kan do tagan la problem do tagan la dawai la metabolism do alag thake matlab tagan la dose to same olop dangor bacha 6-7 years kan be their same dawai do use kuri siguli bi below 2 years kan do tagan la liver bi mature na idula opore tagan la do dose do bi kiniga kam kuru do bi jane na to tagan la do lab to bi iman do na thakibo but side effect to bishi thaki jay. So cough syrup kan aro cold medicine la side effect kan do over sedation over bachagan idu khaina over drowsy nin lagi jabo pare no libi tang la heart rate kan increase hobo pare aur kidaba do over increase korle heart attack bi hobo pare bacha sas slowly diktari paigena vomiting kan hobo pare so idu kan sob side effect to dikhia bra government ba bachagan gidu idu na cholabi lage inika bi no but bishi cautiously cholabo lage that is what their warning is.
Okay, so soap cough syrup is it dangerous for children or only for certain types?
Yes, exactly. That is a very valid question. Now, cough syrup, which will even for normal parents, can abnian bacha kan thake kan all bimar simar but doctor kan ki nolibi khori bi dawai cholai thake. Wo cough syrup to alag alag naam de ahe.
Okay.
So company hisab ti the same dawai the exact same thake libi naam bi alag hobo pare. But at the same time kunuwa just in layman term dry cough or wet cough asina na inai bi hobo pare na. So but there is many different components in the cough syrup. So in there unfortunately what we are getting is ekta cough syrup te almost sub cure all type thakibo. So especially our cold medicine sordi la medicine do tadi do aro bukhar garni bi thakibo sordi garni bi thakibo. So tinta charta component mix kora do it's like tala dosing hisab ti do it's very dangerous. So idu garni sab cough syrup to iki no hai.
Okay, acha to can you explain why medicines are safe for adult or may not be safe for babies and toddlers?
Yes, that's why मैं आगे दी भी इधर point out करना बच्चा toddler especially less than 2 months and then especially again for very young 6 months and below ताकन ला दो body तो same ही ऐसे liver lungs कान मोहन सब same ही थके लिबी ताकन तो mature होना है that is why we call them as children and then we are very cautious and very guarded regarding ताकन के दवाई दिया दो so ताकन की दवाई same adult मनु बच्चा कान even dangor bacha or dangor bura buri khan ki diala same medicine to disiguli to tahan metabolize kru ido digest kru bole any simple term ba digest ko digest kru bole aru idula effect kan do ekdam extra hoy jay so kidaba do mon na jani na over the counter by ni parents can be pharmacy ba kuchi time de kinina de or without prescription na sage na disiguli do overdosing holi bishi chance thake to idu garni like that is why is medicine is same but because of the human body thagelibi bachagan la tangla reaction or action to alag thagaba that is why it's very not safe to just give randomly to small children.
Okay, apni etia kwa nishna these are like very common bishi common bimari ase cough khan cold khan thaga do to most of the parents yes kunba do diktari hobra hospital jawle na paribi thagiu pare holi kunba do ekuno he monine mohan inigai di thage goine parents can do without consulting the doctor over the counter cough syrup can do inigai di thage so what are the risk of doing so?
So idu problem do idu as there is a practical problem and there is also that idu medical problem ekta thake ki on one side mon phui lagi ki bacha la bimar simar ho do bacha kan kida bimar ho start kurbo as parents so manu bi jani kida tahan bimar ho mon la stress to over dangor manu bimar ho dam di do hoy idu dam di phui lagi but when it comes to children mon la tahan gi morom lage tahan nijor ba ko na parbo mon bi emotional state to alag thake idu an bi kina holi bi do phal intention ba kore so of course city di town than doctor or specialist bachagan la pediatrician gan thagala jaga di it's okay one way but not possible for all over different places so them the over the counter bi cholai na ki problem ho jay but one thing you have to understand is ki apnian bachagan la the 2 years and below the sordi kasi to bishi hoy holi bi in almost 90% of the cases these are viral sordi kasi thagi jay so ekku duk to pai of course no doubt bukhar hotia je kasi grazi duk to pabo but idugan ba serious hoigina especially mon ekta kotha bhui lagada pneumonia bacha gan gi kiba ekta hoile pneumonia ho jabo muri jabo serious ho idu la bhui bra so main thing I want to tell to the parents and caregivers is that ki first thing bhui na koribi bhui debi normal manu to bhui lagibo but overreact na kro like ide overreact krobo mon khushi dawai dibole tage bacha ke bhal ho demni jaina khushi dawai ani na tamatam dibo in there are some cases where it's noted that ki even dawai debi thik ekta holibi julli bhal noi gana julli bhal hoi dibo garne ek din di dui bare dibole lade char bar bi di jay so indirectly same right dose holibi overdosing hobole chance ase so inige ase idu garne mon home remedies kan kunuba moi koi dibo idu kan ke follow kurigena main thing to panic no kurigena bacha gan dido bimar holibi over dawai cholawole na lage guna pat dawai na dibo lage
okay acha to apni condition itia bacha ase taha laga system khan to be fully grown honai ami khan dangor manu khan laga nishna noi to iniga cases khan thaga time de apni lop viewers khan especially toddlers khan noili bi bacha thaga khan parents khan karne home remedies ki kurile bhalo to la pore lop koi dibo paribo
yes home remedies sikla noina this is applies to all of us even as sometimes as a pediatrician as a doctor we also over adventurous ho jay mon bi na jani na parents khan bra kotha koina mon bi over treatment bi kuri jabo pare so sometimes as a human we may also be limitations thage even directive government khan bra idugan na cholabi guna scientific fact thageli bi even healthcare providers are sometimes under pressure or by willingly or unwillingly we also commit some mistakes also so this incident should be an eye opener for all of us so home remedy like I said it's not only home remedy but even in our day to practice also monbi as a doctor we will try to implement this so first thing is like I said mondi rakhibole do bishi wala 90% of the time idu ganda tai nijo self limiting ase duk paili bi 5 to 6 days la majudi bhal hoi jabo so simple thing you have to do is bacha gando bhal bra hydrate kro lage yani pani sani gan tagan bhat chat kanu khabo na parli bi mani holi bi dudh holi bi regular di thakibo lage second thing do taila singan khan olai nak khan block hoi thakili do simple nose saline water to pai jay which is just normal water as sterile water idu nak khan di talina nak to block na ho kani do cholao pare aur room do para tak humid rakhibole try krobo ha to humid rakhibole karne do mon khore pani gan steaming khan cholao pare and then like simple home remedies like you know traditional honey ginger idu an bi mixture kan cholai siguli it does help this so and in a very safe way idu to sob jaga dibi town di olibi busti di olibi don do sob pai jay so idu one simple remedy follow kurbo aru bacha gan do humai na thaga dam de olop matha to ucha gorna olop buhi digina humawo di siguli do apni baby choto ajiguli hat ti thuru pare olop dangor 2-3 years kan di do bedside to olop matha do up kuna humawo di siguli do and then like yeah of course fever kan do simple paracetamol it one home remedy cholao pare but itu time de kunuba danger sign bi mondir rakhibo lage ki bacha do bukhar he na name continue bukhar apni gan paracetamol khodi di sai je choto moto moi ko gan de kurise continue cough korna ekdam ekoi na khawa chis de urine output komti ho jai che sas lo li do olop speed to over ho jai sas lo dam di jor ba duk paigena loa nisna jule iduan olop serious one nisna jule do khordi bishi dire na rakina dur holibi hospital doctor nurse khan gi bisai na jabo lage so libi kwanisna again 90% of the time simple home remedy ra bhal ho jay so idu lai sabti phuina lagina dawai pat ne digina khordi treatment kro pare
so thank you so much doctor apni bra bhal bra do cough syrup lagao pore bhal bra explain kore dawne thank you so much and wish you all the very best
thank you so much
okay all right that was in conversation with Dr. Apong Longchar MBBS DCH MD pediatric allergy and asthma specialist tai bar bi bhal ba janai dishi ki itia ami khan dawai khelai dia ase kulibi dangor manu laga dose nishna bacha ni du khelaw na parbo according to the age and weight itu laga hisab te khelawo lage aro sob time iniga bimar hoise gule do jaigine dawai kini ne khela tu ekla brand hoy holibi ghore home remedies ki ase etu khan bi banai ne amen khelawo lage holibi judi bacha to bishi serious hoise gule to ami khan ekla ghore ina na rakhine take it to the nearest doctor aro tahan la modot pi lobi ko ine ase aro ami khan parents khan bishi baktu over the counter nijor laga own knowledge pra jaigine dawai khan kini ni khilai de but we should not do that kile kule do itu rabi bishi ami khan laga kidneys khan noheli bi liver noheli ami laga central nerve system khan do bi biya kuri de itia gane man ase for more news and update keep watching Global Window. This is your reporter Yaungamla with my camera person Anungai Jamir reporting from Nikos Hospital Dimapur.
Boss